Good morning, everyone. All right, so today we're going to be working on slow, easy movement, bringing in our breath, but specifically focusing on low back and knee. I got basketball camp, second week in a row, lots of hours on the court. My knee is swollen, unhappy with me because I like to teach drills. And I teach drills the way they are done in games, which means a lot of jumping, a lot of dynamic movement. Irritates the knee, which then irritates the low back. So I had some low back pain last night going to bed, waking up this morning was a little rough. So that's what we're going to be focusing on, how to get some breath into that low back space, how to mobilize it in a way that helps keep us functioning, because I got 4 more hours on the basketball court today and tomorrow that I got to get through, and you got to get through your day as well. So let's get started. We're going to start on our back, making our nice big C shapes with our hands, thumbs going into the low back, index fingers going into the front abdominals. Hands are going below the rib cage and above the hip bone in that nice meaty section of the abdominal wall. And we're going to kind of cinch or clamp the hands in to create some resistance for our inhale breath. And on our inhale, I want to fill up that abdominal wall like we're blowing up a balloon. So it's going to press into the thumbs in the low back. It's going to press forward into the belly, into the index fingers. And I want to feel it expand out through the sides into our palms. So we're going to inhale through the nose. Nice big inhale, feel that balloon expand. And we're going to exhale by drawing our navel into the spine, like you're trying to touch your belly button to your spine, and then really kind of even pressing your spine into the floor lightly with that belly button. As soon as you exhale fully, we're then inhaling, and again, feel that expansion out and away of the abdominal wall, blowing it up like a balloon. And we're going to get 5 to 6 nice deep breaths. Each breath, allow your hands to clench down a little bit as you exhale. And on the inhale, fill up that breath. Feel your abdominal wall press out against your hands to expand your hands out and away. And by the last breath, see how big can you blow up your balloon. As you're inhaling and exhaling, I also want to make sure that shoulders and head are not tense or lifting up. Feel your shoulders relax down to the floor. Feel your head drop to the floor on the exhale. Once we get to 5 or 6 breaths, we're going to let our legs go nice and flat. We're going to bring our arms up to a Y position. We're going to do some light baby roll stretch. Now, we're addressing some low back pain. So I want to make sure we move incredibly slowly to make sure that we're not moving into pain into the low back. So we're going to lightly press our heels, both heels into the floor, pressing down. Feel your heels engage downward into the floor. We're going to re-engage our nice big inhale through our crocodile breath. And as we exhale, we're very slowly going to lift our head and reach across our body. But again, I want to go slow as we exhale to make sure we're not moving into any pain in the low back. Inhale, we're bringing it all the way back to the floor. Exhale, we're going to reach across to the other side. If there is pain in the low back, we need to keep it either well below a level 3. Level 1, level 2 is a slight discomfort on a scale of 10. If it's a level 3 or above, and if you cannot get it to drop below a level 3, then I don't want you to do this movement. I don't want you to continue to trigger pain in the low back. If you can keep it where it's at a level 1 or a level 2, slight discomfort, it's kind of like that, it's kind of a juicy stretch. It's just barely painful. Not painful enough to trigger, like where your body wants to tighten up, but where you can kind of breathe. It's kind of pain that kind of feels good, not bad. There's a big difference between that level 1 and 2 and a level 3. Once it gets to that level 3 and above, that's where we need to back off. As we're reaching back and forth, again, I want to keep the heels engaged with the floor. So I want to watch out for one foot wanting to lift up off the floor. I also want to prevent one foot pushing down too much through the floor. So keep getting the heels even as you move side to side. We'll do 5 to 10 reaches across. As you're going back and forth, notice if it's a little tighter reaching with the right hand compared to reaching with the left hand. Again, my low back, right side low back, a little unhappy. When I reach across with my left side, I got lots of access to space. Not a problem over here. When I reach across with my right hand, it's tighter right off the bat. It's not painful, but I definitely have more restriction. I can't go as far. It doesn't feel as smooth. We'll come back to our starting point, arms up in our nice Y. And we're now going to do our reaches across with our legs. I want to elevate the leg and I want to keep it kind of high, a couple feet off the ground. We're going to reach across the body as if we're putting that leg up onto a couch or a chair or a shelf. Hip has to lift up off the floor. Shoulder can lift off the floor as well, but try to keep some contact with the back of your hand or your fingers. Inhale as you come back to the center. Exhale as you lift and reach across to the other side. Again, I don't want to go into pain. This needs to stay in that level 1, level 2 of slight discomfort, not getting into triggered pain. Keep the movement small to start with. We're not going big. And pay attention, how does it feel right side compared to left side? Again, my right leg, when I reach across, gets into that right side low back. This side is a little tighter, more restricted than my left side. When I reach with that left leg, oh, I feel like I can get nice and big. I can actually reach back through my fingers. It's a nice, juicy stretch. Feels good. When I lift with the right leg, it's not painful, but it's definitely got some tension and restriction in it that is not the same. Although just the act of moving back and forth in that comfortable part of the pain scale, that level 1, level 2, as I get more reps, keeping it synced with my breath, I'm feeling that the low back is starting to loosen up and I'm getting a little bit more range. We'll bring the legs back to center. And from here, we're going to very slowly get up. We've done a decent amount of breath work to start with, so I want to come up to a seated position first. Make sure that we are not lightheaded and dizzy. And then we're going to grab our staff and we're going to slowly come all the way up to a standing position. Again, I want to make sure that there's no lightheadedness, no dizziness. I'm still feeling that low back, just getting up off the floor. So we're going to do a little bit of shoulder mobility. Grabbing the staff with a nice shoulder width grip. This is where I want to think about bending the staff like we're trying to break it in two. And I want that to create a spiral from the wrist through the elbow all the way up to the shoulders. We're spiraling those elbow pits up to the ceiling. Again, we're trying to break the staff. So we should feel that spiral through the wrist, and I want to feel it through the shoulder blades. Feel the shoulder blades packing down and back on the upper back. We're going to, with that active bend in the staff, we're keeping the staff at our hips, at our waist, and we're coming back to our breath first. Inhale, fill up the belly. Nice big inhale. Exhale, we're drawing our navel into our spine. Inhale, filling up that belly, and start to notice there should be a natural movement of the pelvis associated with our inhale and the exhale of our breath. As we inhale, I want to let that movement, that breath move into the belly. Pelvis tilts forward lightly. We start to get a little sway in our back. I want to go light through this. Again, we're dealing with low back pain. So flexion and extension of the low back, which is what we're going to get with tilting of our pelvis, might be a little uncomfortable. So inhale lightly, get a little sway in the back, belly opens up. Exhale, navel comes into the spine, and we're scooping the pelvis. You may get a little stretch in the low back on that as well. So making sure that you have mobility of the pelvis. Inhale to exhale. My inhale, as I get into spinal lumbar extension, it's a little clunky in the low back. It's a little sensitive. So I'm going slow into it. Exhale, drawing navel in and scoop. And with each one, as long as it is not painful, see if you can go a little further with that pelvis tilting in both directions. Can you get a little bit more sway in the back? Can you get a little bit more scoop as you exhale? And this feels like magic on my low back at the moment. The more I'm doing it, the less tight and tense that inhale breath is on the low back. On the next inhale, as you fill that belly up, on the exhale, when we draw our navel in, we're going to move into our shoulders by drawing elbows back towards the ears at the same time that I'm scooping. I want to have this scoop of the pelvis. Rib cage is drawing down with the pelvis as I'm pulling elbows back to the ears. What I want to avoid here is getting the low back hyperextension where my rib is sticking out as I'm pulling back. This is should be my inhale breath, and I want my arms forward on the inhale. So exhale, drawing navel in, arms, so inhale breath, breathing into the belly. Belly opens up, nice big sway in the back, arms are a little forward. Exhale, we're drawing the navel in, we're scooping as we're pulling the elbows back. Go slow with breath with each one. See if you can scoop more at the same time that you're pulling your elbows back more. The more you're able to hold that scoop, you should feel a little bit more stretch potentially in that shoulder, especially around the armpit areas. You may feel more stretch in that low back. So again, I want to make sure we're not moving into pain on the low back or on the shoulder. We'll do a good nice 10 full breaths. And then we're going to drop the arms down. We're going to move the staff to behind the back. Palms are facing backwards. I still want to bend the staff. I still want to feel that spiral through the arms into the shoulders, but we're bending the staff away from the body. So I'm trying to bend the staff like I'm trying to break it backwards. From here, I'm going to be less concerned about open of the pelvis, so we can actually get a little bend in our hips on this one. We're going to inhale into that belly. Exhale. We're lifting elbows up towards the ceiling. Inhale, let the elbows drop. Exhale, see if you can lift just a little higher. And I want to try to actively spiral those arms as we're lifting. So it's like as you lift, try to break the staff more, but feel that spiraling of the long arm bones as I try to spiral out. Notice how that opens up your chest a little bit more. We can even add a little lift of the sternum as you're lifting the elbows up. We'll do a good 10 reps on this one. And then we're going to flip our palms over so they're now facing forward, but everything else is the same. We're still bending the staff away from the body. Hips can still be a little bit bent. Inhale, arms are down. Exhale, we're lifting as we're trying to break that staff backwards. Again, I want to see if we can feel that opening of the chest and lifting of the sternum at the same time that we're squeezing those elbows up towards the ceiling. And going nice and slow. On this one, the more that we kind of bend at the waist, you might be able to get a little bit more lift up through the elbows. But again, I want to make sure that we are not moving into pain. I want to keep that level of down below a level 3 in the level 1, level 2. We're going to go ahead and set our staff down to the side. And now we're going to do some bowls of soup. We're going to keep arms kind of low for right now, spreading hands nice and wide, spiraling the palms up as much as you can to the ceiling. So I want to turn palms up, and really I'm saying, how far can I even go beyond that? Can I turn that thumb down to the floor behind me? Feel how that opens up the chest and lifts the sternum up to the ceiling. Then we're going to internally spiral the palms. And I'm doing both palms together right now. So we're going to internal the palms, and we're going to let them float to in front of the body and continue to spiral as far as we can go. Notice how that makes a little bit of a kind of arches our upper back. We get a little rounding of the upper shoulders. See if you can feel that stretch in between the shoulder blades. As we spiral the palms back up, we're bringing them back to our side or even a little bit behind our hips. As we open, lifting the chest up to the ceiling. Exhale as we spiral in and reach forward. Inhale as we draw the arms back and spiral the palms up to the ceiling. We can also get into that pelvic tilt on this. As the hands come forward, internally spiraling, we're drawing the navel in, scooping the pelvis so that we're getting nice and rounded through the upper back, down into the lower back. Again, we might feel some stretch into that lower back. Want to make sure it's not pain. As we inhale, arms are drawing more down to the side, palms are spiraling up, belly is opening up, we're getting a little bit more sway in the back. Good. All right. Now we're going to slowly get down to the floor. Ooh, feeling that low back. So I want to get down nice and slowly, taking our time. Spreading fingers out nice and wide, getting into our quadruped. Want to ground palms and extend elbows fully without locking. Want to have the back toes tucked underneath lightly. And we're going to do a little bit of very light wrist mobility. So we're going to start with a little rocking forward and backwards. On our inhale, I want to let my hips rock back, hips to heels. Feel that load into the big toe joint. I want to feel some stretch in the toes and in the arch of the feet. As we exhale, we're rocking our hips forward, loading into the wrists. Light reload. I don't want to force into the wrists, but I do want to feel a little bit of press into that wrist and just notice how does it feel on the right wrist compared to the left. Inhale. We're rocking back, hips to heels, feeling the toes. Exhale, rocking forward. Lightly going back and forth. As we're doing this, notice the difference of the right wrist compared to the left wrist and the right toes compared to the left toes, especially the big toe. Does one side feel tighter and more restricted than the others? And we're going to turn fingers out to the side, and we're going to work our little side-to-side glide, going back and forth. Nice push-pull through the palms. I want to feel that palm pushing away. I want to feel the palm pulling in, so both palms are actively moving in both directions. Also kind of noticing how the shoulder blades slide and glide along the rib cage. This is a great place to notice if there's a difference in how that right wrist feels different compared to the left, or the right shoulder blade feels different than the left. Does it slide a little differently? Is there a little bit of achiness or discomfort or clunkiness associated with it? Then we're going to turn fingers all the way back towards the knees. Closer the hands are, the less intense this is. The further out we come, the more intense. Again, I want to stay soft and light. We're now inhaling as we go forward. Exhale as we let our hips sink to hips, keeping the palms grounded to the floor. I'm going to feel that stretch a little bit through the front of the forearm space. And then after 5, we're going to come off the wrists. We're going to roll them out a little bit. We're going to come back to the wrists here in just a second, and we're now going to get into our cat-cows. Really, we're going to start with our pelvic tilt. So, again, grounded palms, spread fingers, tucked toes, and coming back into that breath. Breathing into the belly, fill the belly up. Exhale, draw the navel into the spine. And just like in our standing position, this is inhale to exhale is going to start to move our pelvis. So on our inhale, allow that pelvis to tilt down to the floor. It's going to give us a little sway in our low back. On the exhale, draw the navel in and scoop. Again, go light. If you're dealing with low back pain, this might be a painful range of motion. It might be more painful on the inhale going into low back extension, or it might be more painful on exhale as you go into low back flexion. Which direction that it hurts matters, so pay attention to that. But if it is painful, then I want to stay small in the movement. It cannot go over, it cannot be a level 3 or above. It has to stay below the level 3. If you're even getting a level 3, you're going too far. If you're able to stay under that level 3, you might find that after about 5 to 10 breaths, it starts to give you a little bit more range of motion. In which case, we're now going to start to allow that movement to move further up the spine. As we exhale, we're going to continue to scoop and feel that movement wave up the spine. As it gets to the hands, we're going to press into the floor, feel the shoulder blades spread, allow that movement to go over the top of the head. And we're trying to touch tailbone to forehead at this imaginary point in the middle. And then we're going into our inhale, drawing the pelvis down to the floor, then it draws the spine to the floor, then it draws the chest to the floor, and then the head comes up last. See if you can feel that wave-like action, starting from the tailbone and ending at the head. Just like with our other movements, I want to make sure that we are not moving into a level 3 pain or above, especially with the low back. Like I said, my low back I woke up with low back pain. And at certain, I mean, I would say I sneezed, um, and it was definitely a level 6 or so on that. So it was a significant pain. In general, just with movement, it's probably at a level 1 to a 3 with just walking, where it was this morning. So all of these movements I'm doing right now, I am keeping below level 3. I have not triggered a level 3 in anything. And in fact, as I'm going through the movements, I'm getting more mobility, more access to movement with less discomfort in the low back. So it's kind of the point of all this, is to improve mobility with less pain so that I have more function going through the day. All right, we're now going to shift into our V-sit. So part of dealing with low back pain is going to have a huge association with hip mobility, things going on in the hips. So we got to do some mobility work in the hips as well, especially since more than likely this low back pain has a lot more to do with the swelling and inflammation in my right knee. Getting 5 knee surgeries in this right knee, and a lot of jumping and cutting in basketball does not make for a happy knee. So it is swollen. This whole leg, knee, all the way down to ankle and foot is bigger and swollen compared to my left side. And that creates a whole bunch of movement issues for the rest of my body. When there's swelling in the knee, the hips, the spine, they don't work the same way on the right side as they do on the left side, and it creates some significant imbalances and some pretty significant compensation patterns. They're there to protect you, but yet they also can create some pain symptoms of their own. So they might be able to help you get through your day, but you also may hurt a little bit more at the end of the day because of that. So in our V-sit, pulling the tops of the foot back towards the shin actively as you can, actively reaching the back of the knees down to the floor. Hands are coming to the floor behind our hips to help keep our spine tall. I want to try to sit on our sits bones. I want to feel that pelvis a little bit more forward. If you find that your pelvis is tucked underneath, then this is a level of pelvic and low back mobility that we want to work on. This is something I would consider an important project to work on. It's not one we want to force, but we definitely want to give it some good attention. If you're not able to get that on your sits bones, use your hands to stay as tall as you can, and this will be part of working on getting that mobility back. We're going to focus on our knees, spiraling the knees out and away like you're trying to touch the floor with the kneecaps, and then spiraling the knees internally like you're trying to touch the floor on the inside with your kneecaps. While we're doing this, we're keeping the feet actively pulled back towards the shin and actively reaching the back of the knees down towards the floor. I want to be very active here. You should feel your quads kind of engaged. The more active you are with the foot and the back of the knee, you should feel this mobility deeper in the hip socket. We're working into those deep rotators of the hips, which are basically our very coiled suspension springs leading into the low back. So when these springs don't work, when these muscles are tight and restricted and don't have their full range of motion to take us through internal and external rotation of the hip, that creates compression in the hip, which then compresses the low back, and that tends to hurt. At some, it will end up becoming painful eventually. So going nice and slow in both directions. Now we're going to let our feet stay relaxed, keeping toes straight up. I still want to be active in the toes and active in the back of the knees, but we're now releasing the hands from the back, and we're going to start working on some light folds. Again, want to go into this lightly because we might be dealing with some low back pain, but we're inhaling, filling up, getting nice and tall. Exhale, we're letting our hands reach forward and we're folding our chest Going light, not forceful. Inhale, we're bringing it all the way back up. Exhale, seeing if we can reach slowly. And if we're able to, we can go a little further. Again, making sure that this is not painful, especially in that low back space. Try to keep the hands perfectly square and even. If you're finding one hand is reaching farther than the other, try to prevent that. Only go as even as you can. And what you might find is that the reason they don't want to stay even is that one side low back is tighter than the other, and it's preventing one side from reaching as far. So that's a good thing to notice. With each inhale, getting nice and tall, and with each exhale, without going to pain, we're seeing if we can go just a little bit further. Once we've gotten a good number going, we feel where our mobility is, we're going to start to move a little bit side to side. We're going to go off center. I'm not quite reaching out to my heel to start with. I'm just going a little off center, but I'm still keeping both hands reaching evenly together. I still got both feet actively pulled back and both knees actively reaching the floor. As we go off center, you're probably going to notice right off the bat, one side is tighter. It might be tighter through the back of the leg. It might be tighter in that low back. Again, real useful information as we go side to side. And as we're moving through this, we can start to make our reach a little bit wider, starting to move further out towards the heels. So my right side, back of the leg, is a lot tighter and stiffer, especially right behind the knee where I got that swelling. When I reach to my left, though, I feel that right side low back, which again, compensating for that swelling in the knee. A lot easier on my low back when I reach to the right, but I feel it more in the back of the leg. We can keep reaching out further, wider and wider. We can reach out to the heels. We can even go beyond the heels, going past the heels outside the leg, only if it's not painful. Good. All right, so now we're going to shift into our shin box. And I'm starting in my left side shin box. This is the easier side for me to get into. But again, since we're dealing with low back pain, I want to start really slow. And I really kind of want to just assess to even make sure that this position feels good. This is my easy side. It's not so bad on this knee. I feel a little tightness in my right hip, but for the most part, this side's easy. So we're going to go to the other side so that we can kind of compare. So when I come to the other side, my left hip, tighter. If you follow my class, my left hip's always tighter. Again, this is related to low back pain on the right side and a swollen knee. My left hip is generally more tight because it's compensating for this instability in the right side. And I do feel my low back on this right side a little bit. It's not painful. It's painful. I'm going to put it at a level 1. Level 1 counts as pain. So whichever side is the more sensitive side, that's the side I want to start on for this. And we're going to focus on that back hip. We're going to inhale, seeing how low can you get that hip to drop to the floor. As you inhale into that belly space, exhale, we're drawing our navel into the spine. Inhale, filling up that abdominal wall like a balloon. And notice, is there some stretch, especially in that low back space, associated with your inhale or your exhale? My inhale, I feel a stretch in the low back on the right side. So I'm pointing on the front, but it's kind of right here, but on the back. Right along just to the outside of the spine. On my inhale, as I'm dropping this back hip back, and it feels like a stretch, but it's a little bit uncomfortable. Like it's definitely tight with that breath. Exhale, drawing navel into spine. Inhale, lightly moving into that stretch. After about 5 breaths, we're going to start mobilizing the back hip. So inhale, we're letting it drop to the floor. Exhale, we're lifting it up and we're moving it forward and seeing how far can we get the front of the hip to move forward, like it's rolling off the floor and going forward. So inhale, I'm letting that hip drop down to the floor. Exhale, I'm lifting it off the floor and I'm pushing that hip bone as far forward as I can. Seeing if you can feel some light stretch through the front of the hip. And again, on my inhale, I got this stretch in my low back. And exhale, I got stretch in the front of the hip. So I'm just softly working both of those. I'm inhaling, trying to get a full breath in, and seeing if I can mobilize that area that feels tight in the low back without forcing it. I don't want to elevate it in the pain scale. And then on my exhale, can I move into that stretch in the front of the hip a little bit more? Can I get that to mobilize as well? After 5 breaths, we're going to move and do the same thing on the other side. So inhale, allow that back hip to drop to the floor. And we're going to start with just breathing and expanding on our inhale into the belly. Exhale, drawing navel into the spine. And just comparing how does it feel on this side compared to the way it was on the other side. My low back, I don't feel anything. Hip, it's a little tight, but not anywhere near the same as it was on the left. I don't feel the stretch associated with my inhale breath on this side or the exhale. On the next inhale, we're feeling that hip drop. On the exhale, we're going to lift it off the floor and reach that hip as far forward as we can. See if we feel some stretch in the front of the hip as we draw that navel into the spine. Inhale as we let it all the way back to the floor. Exhale as we scoop it forward, drawing that navel in. I have a little bit more stretch associated with this front of the hip on this right side. It's not more than it was on the left, but it's more than it usually is. It's a little tight right here in comparison to my normal day, everyday assessment. But I don't have a stretch associated with the inhale breath in my low back on either side, but I'm still trying to breathe in and expand as much as I can into it. Exhale, being very light with the stretch on the front. I don't want to be forceful. Once we get to 5 on this side, we're going to go back to the other side again. Now we're going to add in a little reach with rotation. So we're going to do the exact same movements. Inhale, letting that hip drop. Exhale, scooping it, reaching it forward as far as we can. And this is where we're going to add in our reach. So with that hip moving forward, imagine you got a piece of bread and you're reaching it to your buddy who's just straight through the arrow of that knee. Reaching straight through that knee like you're trying to hand off some bread on the exhale. Inhale, you're bringing it all the way back. Allow that hip to drop. Fill up that belly. If there's a stretch associated with the inhale, breathe into it. Exhale, hip goes forward. And then reach and rotate second. Nice and slow breath in. Nice and slow breath out as we reach. Again, I do not want to move into pain. This needs to stay in that level 1 or 2 of slight discomfort not getting into a 3 or above. Once you do 3 or do 5 on that side, we're going to slowly move to the other side. We're going to do the same thing. Nice grounded palm. Inhale, let that back hip drop. Exhale as we reach that hip forward, and then add in our reach and our rotation. Oh, and I'm feeling my right side low back on that one. So other side was tight. It was tight related to the left hip. And this side, the hip feels fine as I get into extension, but then as I add in my reach and rotation, I feel that right side low back. It's not pain. It feels good. It's a nice juicy stretch. So I'm saying soft with it. I don't want to force it. I want to play with it. When it feels good and juicy, I want to be playful, not forceful. Best way to make something that feels good feel bad is to push it and force it beyond what it is comfortable with. So play in the juiciness. Good juicy stretch means that it probably just needs some soft mobility work. It just needs some movement. Get some lubrication. Get some neurology into the area so that we get a good sense and feel for that space again and reacquire good movement through it. After 5 on that side, we're going to switch back to the other side. And now we're going to get into our folds. So on the folds, I'm reaching through the shins, similar to what we did with the V-sit. I want to reach with both hands even and square. Again, going light into it as we exhale. Inhale, we're coming all the way back up. Exhale, we're seeing if we can reach a little further without going into pain. We're going to do 5 on this side. Again, with each one, we're seeing if we can go a little further without forcing it. And get a good sense of where do you feel this? I feel a little bit in that right side low back. I feel a little bit in the back of this hip on the right side. After 5, we're going to slowly shift to the other side, and we're going to do the same thing. And I want to compare how does it feel on this side in ways that are different than it was on the other side. So again, nice inhale. On our exhale, hands are reaching even. Inhale, we're bringing it all the way back up. Exhale, seeing if we can reach a little bit further. Inhale, we're coming all the way up and we're filling up that abdominal wall. As I'm on this side, I'm finding that I'm not quite as tight in that low back, although I do feel it a little bit in this right hip. A little bit more than I usually do. Probably associated with increased inflammation in that right knee and the level in which I was playing basketball yesterday. Once we get 5 on this side, now we're going to start working back and forth. This position right here, working on our folds and our shin box, if it's not painful, is one of the best movements for getting some good hip mobility and some relief into that low back. Because the glute space, that glute, in the low back they're kind of one continuous tissue, and so tightness in the glutes are going to contribute to low back pain. So a lot of times if that low back feels really tight, it's probably because you need to mobilize your hips a little bit, especially in that glute area. So we're going to do a nice fold through one side. As we inhale, we're coming all the way back up. We'll do an inhale and another exhale as we transition across to the other side. Sorry, exhale and then inhale so that we're ready to exhale as we fold on the other side. Inhale as we come back up. Exhale as we go across inhale as we finish across so that we're exhaling on our next fold. And we'll do a good number going back and forth. I want to do like 5 to 10 reps. And with each one, we're going slow and we're seeing if we can get a little further reach through our fingers. Can we start to drop the chest a little bit lower? As I'm reaching with my hands, the leg that is in front, I want that hip to remain on the floor. So right now, my left knee is the one that is in front. As I reach, I don't want that left hip to lift up off the floor. I want the hip to be able to remain grounded as I reach. So that might be something to pay attention to as well. Do you find that hip lifts up as you're going back and forth on your shin box? And does it lift up on one side and not the other side? Now, once we've done 5 folds on each side, we're now going to start to open up our shin box. We're going to let that back leg slide open a little bit more. Our fold will no longer follow our shin line. It's just going to go where it needs to go, where it feels good and juicy. Again, moving slow with our breath, extra breath cycle as we transition across. Open up that back hip and nice fold. By going slow back and forth, this gives us a great ability to compare. How does the right side feel related to the left side? Where do you feel tightness on the left that is not there on the right? Where do you feel it on the right that is not there on the left? It's not uncommon to feel tightness and tension in one that's different in one area on the right side, and to also have tightness and tension that is on the left side that is different on the left side, right? You might find low back on the right is really tight and the front of your hip is really tight on the left, or vice versa. Those are really important and helpful as far as understanding what's going on in your body, what is compensating for what, where is your body moving well compared to where is your body moving not so well. As we're getting closer to our 10, I want to continue to let that back leg slide back and open, only going as far as it feels comfortable. I don't want to be moving into pain. I am not interested in a yoga pigeon pose, in a classic pigeon pose, if getting into that pigeon pose is painful. That defeats the entire purpose of our movement practice. The pose, the end range, is the least important part of our practice. And if we make it the most important part of our practice, it will come at the expense of your comfort and your movement capabilities. All right, let's go ahead and get back down onto our back. We're going to make our nice big C shapes with our hands again. Thumbs in the rear, index fingers in the front. And we're going to finish with nice crocodile breath. Inhale through the nose, fill up that abdominal wall. Feel that pressure push out against the thumbs, the index fingers, and the palm of the hand. Exhale, draw the navel into the spine and clench the hands down in order to create a little bit more resistance for the next inhale. And with each inhale, see if you can expand that balloon a little bit bigger. On your exhale, make sure that the head and the shoulders are softening down towards the floor. After 5 or 6 breaths, Let our arms relax down, palms up. And now we're going to breathe more into our ribs. Feel the ribs lift and expand through the chest. I also want to feel that expansion out through the sides and into the upper back. Exhale, continuing to draw the navel into the spine and allowing the shoulders and the head to just soften and relax to the floor. Inhale, breathing into the ribs, up into the shoulders and the neck. Breathing into the tension that you can find. Exhale, allowing that tension to rinse off the body and onto the floor. Each exhale, allow your head and your neck and your shoulders to soften more and more. Any tension that you're feeling, allow that tension to release. When you're ready, you can open your eyes and very slowly get back up. Again, I want to make sure that we're not lightheaded or dizzy as we go from lying on our back doing some deep breath work to sitting or standing. So take your time at each level.